We now come to the backbench debate on the impact of long COVID on the UK workforce. Layla Moran to move.
Thank you very much, Madam Deputy Speaker. I beg to move that the House has considered the impact of long COVID on the UK workforce. And I would like to start by thanking the Backbench Business Committee for allowing us to hold this updated debate on long COVID today. I'd like to also thank my co-sponsors, some of which, Madam Deputy Speaker, I'm sad to say, are at home ill with COVID and would have very much have wanted to be here. Also, the moved week hasn't helped. But for those watching at home, I've been contacted by several members who weren't able to be here, and they are very sorry not to be. But I also want to put on record the thanks to the many hundreds of people who, over the years, have contacted the all-party group on coronavirus with their personal stories, many of them very heartwarming, but also very moving and worrying, because it is a debilitating condition. And what I say to all of them is that we hear you. You have not been forgotten, and we will continue to fight for you. I also want to recognise the actions that the government has taken so far. I was pleased that after the first debate we had on this in January 2021, the government made some £18.5 million available for research into long COVID, including treatment, and then delivered even more funding in the summer, and that is incredibly welcome. In that last debate, I also welcomed the new dedicated long COVID clinics and the publishing of the guidance to medical professionals by NICE, the Scottish Intercollegiate Guidelines Network, and the Royal College of GPs. However, despite that welcome action, it has felt over the last 8 months that long COVID has totally dropped off the radar. And in particular on this issue, there's been very little debate. So I would like to thank the Minister for coming and answering today. I believe it's the first time that the Business Department has answered in this chamber on this. And I'm going to focus my remarks on the effect it's had on the workforce, because our belief is that actually this is a looming crisis that needs thinking about ahead, and it would be wrong for us just to focus on the medical side of it. There are broader implications here. And while it might have dropped off, and there are many understandable reasons, the cost of living crisis and the war in Ukraine, actually I argue that these things are now very much linked, because how are we going to have a strong economy and a productive economy if there are large swathes of our workforce that are struggling to do the jobs that they are meant to be doing? So how can we help them to recover? So in this last year that we've had more information, we have learned more about long COVID, although it's worth saying, Madam Deputy Speaker, there is still no cure. There are treatment plans that can help with symptoms. But for many, I'm afraid to say the last year has been awful. People like Andrew, who was a head teacher who I spoke about in the last debate, a year ago, he would receive multiple written warnings about his inability to do the job in the day. And so I went back to him and asked how he was. He said, "I made the difficult decision to resign from my post as a head teacher, so my limited energies can focus on coming to terms with my illness, rather than continuing to face dismissal from a career that I'd committed the last 25 years to, and one that I dearly love." I also got an email from Nell, one of my constituents who is a doctor. She said, I adore being a hospital doctor. I love my patients, and I trained for years to do this. It's been nearly 2 years of struggling with my health after COVID, and while I slowly continue to recover, I don't know if I can do this much longer. I am so very sorry. I feel I've let you down writing this. Well, to Nell I say, I don't believe she's let anyone down. But I would say I do think, to an extent, the government has let her down. I will, of course.
I thank the Honourable Member for giving way and for her excellent speech in this debate, and to also thank the Backbench Business Committee. She's raised a couple of cases that she has heard, and indeed I have been in touch a lot with a carer, Sam, in my constituency, who at the very beginning, when she had long COVID, it was a condition that people didn't understand and wasn't taken seriously, and has affected her ability to work ever since. Does she agree with me that, as well as the health side and getting more research as to how this affects people and affects them so differently, that it is very important to be having the guidance, I think she'll probably come on to this, for employers, as to how to deal with this, but also how to support those who may have long COVID through that very, very difficult period. And because we don't know how long it lasts for people as well, to have a proper long-term strategy in place for those who are affected and their families.
I thank her very much for her point of order, and she hits the nail on the head, because actually people can recover, and very often do. But the way to help them do that is very badly explained to employers right now, and indeed I'll come on to talk in some detail about that. But the other thing to say is that for many people, they were told long COVID, especially at the beginning, they were making it up, that it was something all in their head. And actually now, and I've got the research paper here, there are scans that have been done on people's chests where they saw the reason they were suffering from breathlessness is because the tissue was fundamentally damaged. This is very much a real disease and now needs a real response. But it's also not just public sector workers that have dealt with this. And I spoke to Rebecca, who gave evidence to the APPG, and she was a fitness instructor, Madam Deputy Speaker. You'd think someone, fitness instructor, very healthy, very good lungs, before anyway. She used to do teach 14 high-intensity classes a week and ran her own business. And now long COVID means she's in bed 60% of the time and describes being unable to return to work, to be the mum, wife or friend I once was. And so it's heartbreaking. It's utterly heartbreaking. Because we now need to accept that if we are going to live with COVID, we also have to live with long COVID too. And yet, in our evidence sessions that we took this year in December and January, the APPG heard how the condition is severely impacting the lives and livelihoods of people still. They describe how the condition has left them unable to work, sometimes unable to move, forcing them into long periods of absence from work, dipping into their savings and doing anything to stay afloat, something of course much more difficult now with the cost of living crisis. A study released this month by Queen Mary University concluded that becoming infected with with COVID increases the risk of economic hardship, especially if the individual develops long COVID. And those individuals describe a patchwork of uneven availability when it comes to the long COVID clinics, and many are absolutely desperate for treatment. We heard from one nurse, for example, who has spent thousands of pounds going to Germany to get treatment that she isn't able to access here. So for the key sector workers, for public sector workers who gave their lives, when we were all allowed to be at home, they went in, and they are the ones, according to the ONS surveys, that have the highest prevalence of long COVID. I do believe we owe them so much more than they've had so far. And unsurprisingly, though, it's not just about the public services as well, because you've got 1.5 million people across the country experiencing self-reported long COVID symptoms. That's 2.4% of the population, and that cuts across every single sector, not just the public sector. In the hospitality sector, a sector that the Minister will know is already struggling, 2.6% of workers in that sector. If you take the 3 million estimate from UK hospitality, that equates to 78,000 workers who are unable to do their jobs as they did before. In retail, it's 2.3%, which equates to roughly just under 70,000. And for personal service, let's say beauticians, it's less than 6,000, still 2.1%. These are big numbers in sectors that are already struggling post-pandemic and already struggling with workers' visas following Brexit. They don't need this. I would, of course.
If I didn't weigh in, congratulate her and colleagues on this important debate. And does she agree that it's not only the people who've had long COVID, but their family members who they have to care for? I've got a constituent, Julie Wells, and she's been her working life's been nearly 40 years. Her teenage daughter on a second dose of COVID has been left with totally debilitating symptoms and now needs constant care. Julie at best hopes to get back part-time to work, but she may not. A full-time person lost to the workforce because of caring for a family member.
Thank you so much for intervention, and absolutely, the caring responsibilities are so much increased, as is the prevalence in children. I was alerted, for example, to a case by the MP for, my friend the MP for St Albans, of a parent who's asking for dispensation for her child in taking examinations because she's missed so many days of school. And I'm talking to the Education Secretary separately about that point. But it does affect the entire family and not just the workforce. And the reason why it's 1.5 million have long COVID, but 989,000 people say that those long COVID symptoms adversely affect their day-to-day activities, and 281,000 people report their ability to undertake their day-to-day activities have been limited a lot. You know, this often means that they have to take part-time work instead of full-time work, and it very often means, sadly, that they're not able to recover well because they're pushed into trying to get back in. The effect on business is now getting better documented. The Chartered Institute of Personnel and Development found that a quarter of all UK employers cited long COVID as one of the main causes of long-term sickness absence among their staff. And for small businesses, that effect can be absolutely devastating. The National Federation of Self-Employed and Small Businesses has shared guidance in how to help with statutory sick pay and arranging for temporary staff cover. But I'm very concerned, and I hope the Minister might take this up, the ACAS guidance right now is pretty sparse. It doesn't make it clear, it signposts to other websites, but absolutely doesn't make it clear that one of the most important things to do with long COVID is very often to let someone rest. They say listen to your body when it comes to medical things. Well, I'm afraid to say with long COVID, that is actually the treatment plan. And if you are forced into or encouraged into, inadvertently very often by the employer if they don't have proper guidance, into work, that can set people back and can cause even more problems down the line. I would urge the government, and one of our main calls is employer guidance, but to also look at things like the ACAS website and make sure that it's very clear for employers how can they help and support their employees to stay at home and rest as long as they need to, so that they can come back and we don't lose people unnecessarily from the workforce. A legal expert speaking to the APPG also described the lack of accessibility to financial support and said that lots of people with long COVID find themselves starting for the very first time being involved in the obstacle course that is our benefit system. It's clear that long COVID is having a serious impact on the ability of our workforce to do their jobs, and we can expect it's only going to get worse as we see the virus spread through the population and we see more cases of long COVID in the future. So what can we do? Well, the All-Party Group has released a report on long COVID this week. If the Minister hasn't seen it, I'd be very happy to give him a copy. In it, we make 10 recommendations, but I'll highlight just a few. First, the government needs to urgently prioritise research treatments for long COVID patients. We have welcomed the money already committed, but would contrast it, for example, with America, who have earmarked $1 billion towards this because they recognise the effect that this could have on their economy. They see it as an investment. I would urge the UK government to reach similar ambitions. The second call is for employer guidelines set out by the Business Department in conjunction with the Department for Health to help all businesses help their employees back into work. The third is for the UK government to launch a compensation scheme for all those frontline workers currently living with long COVID, very similar to, for example, the Armed Forces compensation scheme. He will perhaps be aware that the designation of an occupational disease process is ongoing. We are hopeful that that will report back soon. That's a matter we are discussing with the Department for Work and Pensions, but that could be game-changing, particularly in those public sector areas where the prevalence was incredibly high, so particularly education, the health and social care workforce, but actually also public transport workers were among some of the highest prevalence of COVID, particularly at the beginning. The ONS survey itself very much points to where we need to be looking. But I would urge the government not to wait for that designation, because many of these workers, as he's heard in my examples, have already left the professions. They are leaving the sector. They're deciding to take early retirement. And this is a time when our economy needs a boost. It needs those experienced workers in it. At the moment, we are not paying any attention to this. And the main reason why we brought the debate today is to urge the Department for Business to look ahead, take this seriously. The best thing that we can do right now is to help hard-pressed people in the UK in our fight against Putin, against the cost of living crisis and all the rest of it. If we're going to get our economy back on its feet, we need to get our workers back at their desks. And if those workers have long COVID, then currently there's very little out there to support them and those businesses that desperately want them back.
The question is, as on the order paper, Debbie Abrahams.
Thank you, Madam Deputy Speaker. And it is a
Sorry, excuse me. Could I just say that I think that we can get everybody in with a reasonable amount of time if everyone limits their comments to a maximum of 8 minutes. Debbie Abrahams.
Forewarned is forearmed, as they say, Madam Deputy Speaker. Thank you so much. And it's an absolute pleasure to follow my honourable friend, the member for Oxford West and Abingdon, and congratulations for her for securing this debate, but also for her leadership in the APPG. She chairs it exceptionally well, and I think today's debate and the report that underpins it reflects that. And I also want to thank everybody that has provided evidence to the committee, particularly in relation to this latest report. Their stories are quite moving. They really are, and also quite shocking. In addition to them, I'd like to thank the Secretariat, who do a fantastic job, I think, in terms of providing support to the group. Madam Deputy Speaker, this COVID pandemic is far from over. I'm wearing my mask. We know we've got an outbreak in Parliament. A number of MPs are currently off with COVID. It is far from over. We're seeing case numbers ticking upwards, hospitalisations also on the rise, and sadly there are increased deaths. We've seen the burden of disease from this pandemic once again hitting the most deprived, with avoidable mortality six times greater for women in deprived areas compared to the least deprived women, and nearly 5 times for men. And yet we see a spring statement where the government's rhetoric to level up has no substance. 1 out of the £6 from the Chancellor's tax hike in the autumn given back. There was only 30p from that £1 that went to those of the lowest incomes. Despite the government's hype, their pandemic preparedness was absolutely woeful, and their pandemic management in too many aspects was reckless, wasteful, and even unlawful. What we are now very aware of, Madam Deputy Speaker, is that although many people may have fully recovered from the acute phase of COVID infection, for a significant number, as my honourable friend has said, and the ONS estimate this is over 1.5 million, about 2.5% of the population, the COVID tracker identifies even a larger percentage. There is a longer chronic phase which affects children. We think there are about 34,000 at the moment, women, particularly younger women of working age, people on low incomes, and frontline workers who are more at risk of exposure, including NHS and care workers and those on with an existing activity-limiting health condition or disability. As we've heard, symptoms vary, but fatigue, pain, reduced muscle strength, brain fog, and so on are just some of the symptoms. In my own case, I've experienced prolonged fatigue, bordering on exhaustion, being awake, but my brain being somehow disengaged from what I'm doing, and with nasty bouts of nausea. I believe that COVID has also exacerbated my already severe arthritis after many years of running. Madam Deputy Speaker, this is partly the result. But as I say, this has got considerably worse with long COVID. The pain is constant and sometimes completely debilitating, making it difficult to stand up. What is shocking is the response to people who are experiencing long COVID by their employers. And my honourable friend mentioned some of these cases, but some that I also want to recall was that those that had been disciplined by their employers. They were struggling with this condition, struggling to actually go about their everyday lives, and they wanted to be at work, and yet they were being disciplined for not being back at their desk, not being back in front of a class, not being able to see patients. We had a GP, do you remember? And not being able to do that. And I think, this reflects, unfortunately, very much an attitude of some, but it was particularly disappointing in public sector organisations, and especially so the NHS. The National Institute of Health and Care Excellence brought forward their guidelines for managing long COVID in December 2020. At the time, I commended them on the holistic healthcare approach when assessing a patient with symptoms beyond 4 and 12 weeks, with the emphasis on empathy and acknowledging the impact of symptoms, may have on a patient's day-to-day lives, including their ability to work. And this was a major step forward from previous NICE guidelines on other chronic fatigue syndrome illnesses, which, as I say, are similar to long COVID, but also affect nervous and immune systems. The long COVID NICE guidelines which were updated earlier this month, and I note that these are to be regularly updated, which is again something that we recommended, because there is emerging evidence which we must make sure is incorporated at the earliest opportunity. But I hope also, because I haven't seen evidence of this, that investigations into the range of immune responses to COVID, as well as immune therapies, will also be incorporated. As I mentioned last year, the British Society of Immunology and several others have suggested that in addition to long-term damage to multiple organs, the pain, muscle weakness, fatigue and even brain fog often associated with long COVID may be due to inflammatory issues associated with our immune response rather than COVID itself. We know that COVID-19, like other viruses, attacks multiple systems: respiratory, cardiovascular, nervous and gastrointestinal systems, as it's attached to epithelial cells which are distributed throughout the body. But our body's ability to fight the virus depends on our immune systems reacting appropriately and not overreacting. Finally, Madam Deputy Speaker, in addition to adequate long-term funding for long COVID clinics providing evidence-based therapies, and that's the key, evidence-based therapies, I pay tribute to my colleagues in Oldham for their helping over 300 long COVID patients. We need to ensure that long COVID is recognised as an occupational disease. This has to be a societal approach, Madam Deputy Speaker. Thank you.
Chris Matheson.
Thank you, Madam Deputy Speaker. A couple of weeks ago, I attended with constituents the service at St Paul's Cathedral that was organised by the Cathedral and Sir Lloyd Dorfman and others to remember those who died from coronavirus. And indeed, in business questions earlier, we heard from my honourable friend for Vauxhall about the very striking memorial wall in her constituency along the banks of the Thames by St Thomas's. But I'm really grateful to the Backbench Business Committee and the Honourable Member for Oxford West for reminding us of all the other victims of COVID who have, in a sense, are the lucky ones who have survived, but who still need our attention. And I declare an interest, which is that a member of my immediate family suffers from long COVID, and if the House will bear with me, I won't actually identify who it is. But for 18 months, the member of my family has not really been able to get out of bed. In terms of work, they were doing well, they were young, the career was progressing, they're getting extremely well rated at work, and almost overnight, that came to a crashing halt. At first, when you suffer from COVID, as I did at the same time as my family member, you hope and believe that if you get through it, that it's going to be awful or unpleasant, but then life will carry on. And then long COVID starts to emerge when, frankly, you don't get any better. And I got better and my family member did not. It was all of the symptoms that my honourable friend from Oldham has described. A huge tiredness, brain fog, aching limbs. And at the time, the best source of advice that was available and the best sort of support, I have to say, was my honourable friend for Denton and Reddish. There was nothing really available. People hadn't come to terms with the disease, with identifying what the causes of the conditions were, and I pay tribute and thank him for his work and his support to my family. I have to say that the employers of my family member were excellent. They still are. They've not been able to continue paying, but as far as they're concerned, my family member is still on their books. They value the contribution that my family member has made. Again, I'm sorry to talk vaguely. I do not want to identify the person. and have said, when you're ready to come back, we're ready to have you. And that's the kind of employment practice that we're looking for. But as my honourable friend from North Tyneside said, another member of my family has had to give up their job in order to be the carer. And what we're looking for, really, is some kind of hope, something to cling on to, something to demonstrate progress. And there has been progress, and I welcome the government's investment of 18 million and the growing recognition of this post-viral chronic fatigue syndrome caused by coronavirus. And every time there's a news item, even scientific papers that I wouldn't normally understand, we devour to try and find an explanation, a cause, a hope of a cure, or a hope of treatment that will get us and my family member through this. Is it caused by scarring on the lungs? Is it caused by microclots? Is it caused by activating POTS, which I'm told is, he looks carefully at his phone, postural orthostatic tachycardia syndrome, which is also bears some kind of relation to what is going on. And the truth is, it could be any one of these in any number of individuals, but that absolute fatigue is the same. And I remember my honourable friend advising me, if you're feeling good, don't do too much. Don't exert yourself. I pass this advice on. I have to say, Madam Deputy Speaker, that it's also the mental effect, that when you are having a good day, you don't want to exert yourself, because then you might be knocked out for the next 3 days. So that forces you to withdraw into yourself and withdraw into your life and not want to go out. So you can't even walk down to the shops. You can't walk to the park even, because you're so terrified that you might then not make it through the next 3 days. And it's that hope and that desire and that almost desperation that when you have a good day and it's followed by another good day and it's followed by perhaps another good day, is this the beginning of the end? Or even the end of the beginning? And for so many, including my family member, it hasn't been that. In terms of this debate, I would ask for the same consideration that has been given to my family member for others, to recognise, for employers to recognise that this is something that the government has recognised as an issue, that the medical establishment has recognised as an issue, and that employers need to treat their employees who have this as also victims of the pandemic, because nobody has chosen to have this campaign, this illness. And I would say one final thing, Madam Deputy Speaker, my message, including to constituents who still persist in saying that COVID-19 is nothing, it's just a cold, it's just like the flu. I'd like to say to them something along the lines of get stuffed. I would simply say there are 130,000 or 40,000 names on the wall on St Thomas's, and there are hundreds, maybe a couple of 100,000 others who are still suffering today and are just desperate for some hope of some better life to come, and the desperation of getting over this terrible long-term affliction. But I am most grateful that this debate has been raised, and I'm most grateful again to my honourable friend for the support he's given my family.
Wanda Chamberlain.
Very much, Madam Deputy Speaker. And I do want to thank my honourable friend for Oxford West and Abingdon for securing this important debate. But I must thank the honourable member for City of Chester for really bringing to life there the reality for many of our constituents across this House and what they're experiencing on a day-to-day basis. Nobody wants to be in the position of experiencing long COVID, and the variety of symptoms that long COVID presents with and the timescales of that, when we think of people who have been experiencing long COVID symptoms right from the very first wave, just shows how difficult, debilitating and an issue that is for this country to deal with going forward. So thank you very much for that. And it's actually only a little over a month ago since I was here myself discussing long COVID and employment in an adjournment debate, which was answered by the Minister's ministerial colleague in the Department for Work and Pensions. And although I was very grateful to the Minister for his responses then, there are some particular issues that I'm likely to raise again, and indeed my honourable friend, the member for Oxford West and Abingdon, has raised some of them, because I think there is very much more that we can be doing. And Madam Deputy Speaker, when I was here a few weeks ago, I quoted the Office for National Statistics figures, which said that in the 4 weeks up to the 2nd of January, it was estimated that 1.3 million people across the UK were suffering from long COVID. That number is now estimated to be 1.5 million, and that is an incredibly fast uptick. Like others, as was mentioned, I've recently had COVID myself. I was in my bed for 4 days, and like the honourable member of the city of, from the City of Chester said, I had a good day and I did too much and I ended up back in my bed again. But although thankfully for me it's mild, I seem to be very much back on my feet, there's absolutely no doubt that regardless of the strain or variant of COVID, long COVID can still be the result of it. So even if symptoms are milder for many, the reality is mild symptoms can still result in long COVID. So that is an incredibly fast uptake, and I do stand with colleagues across the House when we say that clearly this condition is not going to go away, and the Government cannot close its eyes to it. And indeed this morning I met with Results UK to talk about work that I've done previously with them on equitable COVID access, and there is no doubt that unless we do more to help developing countries and other parts of the world in terms of managing this pandemic, we will see future variants, and therefore the risk of long COVID does not go away. Now, just briefly, usually when I'm in this chamber, I do hear colleagues on the benches from the SNP who are always talking about the fact that Scotland is doing a lot better in reality to elsewhere. But I do think that in terms of long COVID, the Scottish Government are letting long COVID sufferers in Scotland down. The work which my friend, the Member of the Scottish Parliament for Edinburgh West, has done has shown that of the 119,000 sufferers of long COVID in Scotland, by the end of February, only 1,000 of them had been referred to the long COVID support services that had been announced by Chest, Heart and Stroke Scotland. And, Madam Deputy Speaker, of the much-needed £10 million long COVID support fund announced by the Scottish Government last September, a recent FOI showed that not a single penny of that money has been allocated or spent. I'm an absolute believer in devolving decision-making to the place where it can be most effective for our constituents, but the Scottish Government on this are failing at delivering, either through efficiencies or errors or something else. And my constituents in North East Fife and my SNP colleagues' constituents deserve better, and I hope to see better in the future. Madam Deputy Speaker, to the impact of long COVID on the workforce, I want to focus specifically on those who would otherwise be working but cannot be as a result of medical condition. And I thank those members who have already highlighted those where employers are trying and helping to work. And I suppose we also have to acknowledge that there are employers out there who aren't doing right by the constituents and their members of staff, and we must work hard to ensure that they do what is required. I don't want to repeat my entire speech from a month ago, but I just want to turn back to a few key points which I didn't feel were properly addressed then. So will the Government commit to extending the period of time that claimants for benefits have to complete their application forms? For someone with a debilitating condition, particularly relapsing remitting ones, like long COVID often presents itself as, 4 weeks is just not enough time to complete a 30-page form, including the collection of evidence, particularly when you're experiencing some of those symptoms. You simply cannot concentrate for the length of time required. It takes up more time and resources to apply for a 2-week extension. So I raised in the last debate, why don't we just automatically apply that extension to give people more time, rather than actually take up DWP's time and resources, as well as the persons to request that extension. It would be a cheap and straightforward step to give enough time in the first place. And will the Government commit to consulting with disabled people, including those with long COVID or other relapsing remitting conditions like ME, about the design of those application forms to ensure that they are properly able to explain the impact of their conditions? I appreciate the ministers from Bays, but surely we've had a cross-government approach to COVID. We need a cross-government approach to long COVID as well. Will the Government accept that the evidence of doctors and specialists who truly understand complex conditions like long COVID is and are relevant to the assessment of how their day-to-day lives are affected? Are they afraid that hard evidence will make it more difficult to minimise payments out to those in need? Sometimes you are left to wonder just that. Will the Government publish its decision-making matrix for assessors and submit it to independent scrutiny to ensure that it allows suitable decisions to be made relating to complex conditions like long COVID? This will also have the additional benefit of considerably increasing trust in the DWP, because we hear about that again a lot in this chamber, and we know frankly that it's incredibly low. And finally, will the Government provide proper training to staff in DWP centres, both front and back office, relating to assessments and work coaching? We want to ensure that they are equipped to work with claimants who are suffering from this new and complex condition. We've heard the variety of symptoms that this creates, but increasing people's anxiety and stress, I am pretty sure, will do nothing to help them. Those who cannot work because of a health condition are the other side of the workforce coin. Everyone must be supported, and those who are less visible need to be given the support that they require. Thank you.
Florandis.
Thank you, Madam Deputy Speaker. I'm very grateful to the member for Oxford West and Abingdon for securing this debate, and also want to reiterate what has been said by many, that we understand that there are so many people suffering from long COVID, and this must be taken seriously by the government, and that we understand the impact that this is having not only on those individuals and their daily lives, but on the workforce. This is an economic issue which will continue to have a serious impact and needs to be addressed. And to reiterate, the main ask that we do have, and that the APPG on coronavirus has in their very helpful report on long COVID, that key recommendation that there are employer guidelines, so that people are not left to the whim and the mercy of different employers as to the understanding and support that they have to be able to continue in the workforce or return to the workforce. I've come to this debate for two groups of people. One are all those suffering from long COVID across the country, and that is an estimated, as has been said, 1.5 million people, which is 4.4% of the workforce. But also those constituents that I have who have been suffering from ME and have learnt many lessons from that, which they think are really, really relevant to working with those who have long COVID. They have been underestimated, not believed, not supported. When they've gone to their GP, they've been told the wrong advice, actually advice which makes their ME worse. They've not been understood in schools, whether by those who are young people or those who are teachers. They've not been understood by their employers, and they don't want anyone with long COVID to go through the same. And I've been disturbed to hear some of the evidence given to the APPG about workforce practices which are not conducive to helping people come back to the workforce, being the best for those individuals and the best for our economy. A couple of my constituents who've written to me are one person who said, "I've now had long COVID for 2 years. We desperately need more investment in potential treatments. It's clear that the illness impacts blood, autoimmune system, organs, brain and central nervous systems, but none of these mechanisms are being treated by the NHS so far. Treatments are being trialled in other countries, and there are questions being asked about the trials being conducted in other countries and what more could be done here." Another constituent said, "I contracted COVID-19 at the very end of September. Like many people, I suffered mild symptoms, but 2 weeks on from my initial infection, I was suddenly hit with a wave of long COVID symptoms, was truly horrified at what was happening to my brain and to my body. I felt drained and broken, and I felt as though a foreign body was inside my head. I could no longer hold even a conversation, let alone work. For the last 7 months, I've been unable to function in any sort of capacity." And finally, my cousin has had long COVID for a long time, and he sent me a list of his symptoms: fatigue, concentration impaired, memory, cognitive loss, internal pain, chills and sweats, not being able to sleep, sore throat, dizziness, shaking, anxiety, faintness and muscle aches. All of these symptoms, all of this, the impact of long COVID, need to be understood by employers, by teachers in education settings, by GPs and all medical workers, as has been set out in the recommendations for the APPG from coronavirus in their report. So I would just underline those recommendations and ask specifically for employer guidelines that are very clear, that should be urgently produced, because otherwise there just is a postcode lottery or an employer lottery from employer to employer about how anyone with long COVID will be treated and be able to return. About guidance for education settings, because many students with ME found that this was really difficult to get understanding to be able to continue with education, and we can't have the same thing happen for those who have long COVID. And guidance for medical practitioners that is very clear for those with long COVID in children and adults, that everyone gets the proper care that they need, support and understanding, so that they can return, that they can have hope, that they can feel that they're not adding being misunderstood to the long list of symptoms which they have already, which will only increase their anxiety. So I welcome this debate. I hope that we will hear some good news from government ministers about the key recommendations of this report being taken up and really good situations being put in place for everyone with long COVID. Thank you.
Shannon.
Speaker, and it is indeed a pleasure to speak in this debate. It does bring back many memories, as the honourable gentleman referred to, and I think there's nobody in this chamber today will not reflect upon those who have been lost over the last year. In Northern Ireland, last week I think it was 3,200 across this great United Kingdom of Great Britain, and Northern Ireland 157,000, I understand. So I think it's fair to say that every family, every person has been touched by the loss of someone. But today, this debate, while we think of that, and you cannot not think of that, I think we're focusing upon the issue of the long COVID. Can I congratulate the Honourable Lady for Oxford West and Abington for setting the scene, and also for the hard work that the Honourable Lady does with others through the APPG to bring this matter to a head, to highlight the issues and to understand it better. Honourable Lady mentioned something I was going to refer to. I've been a councillor since 1985, councillor for 26 years, first elected in 1985, also in the Assembly for 12 years consecutively. Whenever I got in the Assembly, one of the biggest issues in my office has been benefits. It continues to be the biggest issue now ever, benefits, housing and planning in that order. But one of the things about whenever I first became an MLA in 1998, the issue of ME at that stage, the Honourable Lady for Putney referred to it, I just want to touch upon it if I could, because I think the Honourable Lady will know, and I think others will recognise the story of those who had ME. I remember people coming and helping to fill in their benefits forms, and they told me that ME says, you know, my doctor says there's nothing wrong with me. And I says, well, is there any other doctors in the practice that you could speak to? And we found ourselves with a difficulty that this is not a disrespectful to doctors, Madam Deputy Speaker, because doctors are excellent people, and we've got to say that. But the understanding of what ME was about was not really known at that stage. So we had incredible battles to fight to get the evidential base to prove that someone had ME. That whenever they talked and said they had chronic fatigue, you know something they actually had, and it was something called ME, and yes, it was a disease. So the Honourable Lady referred to it. I was going to, but I just wanted to fill in the story of that because I think that gives the evidential base to what the Honourable Lady says. And I think really what gives the evidential base to what the Honourable Lady for Oxford West and Abington and others have said. Can I commend, I'm not picking anybody as special, but I'm going to commend the Honourable Gentleman for the City of Chester for that very personal story. A personal story that the Honourable Lady for East Fife referred to, and because it is personal, it resonates better when it comes to telling the stories, telling a story to back up this debate today. I know that I missed him, he knows that, and I said to him in the chamber, well, miss you, where have you been? And he told me some of the things. I didn't tell me it all now. He told it all today of what he'd been through. And the others in this house have been affected as well, so we thank him for that. Whilst being double jabbed and also had the booster, I was informed from a test here in the house when I got home on the Friday night, early Saturday morning it was, that I had COVID. And I couldn't quite understand it because I had no symptoms. And the lady from the NHS back home phoned me on the Saturday morning. She says, Mr. Shannon, tell me, how do you feel? I said, well, I told you I feel great. Would you be shocked? She says, well, have you got any of the symptoms? I said, I have no symptom whatsoever. And as a matter of fact, I don't think I felt as well now as I did for the last 2 weeks. And the lady was couldn't quite understand it. But the fact was, then she told me what she said, I think you're what, and I wrote down, asystematic. I'm never quite sure really what that means, but I think it means that I might have some immune
special.
My wife wouldn't even say I'm special, you know. But thank you. You're most complimentary. Most complimentary. But I found out that I didn't have any symptoms, but I did do the isolation as I was instructed because I followed the rules, and that's the way to do it. But the point I'm making is, well, I was fortunate and blessed to be one of the ones who was not ill with COVID and was asymptomatic. I was fortunate. This is not the case for many people who did not come through this unscathed. Again, we've all mentioned the figure, 1.5 million people in private households, 2.4% of the UK population across this great nation, United Kingdom of Great Britain and Northern Ireland together, self-reporting ongoing COVID symptoms persisting more than 4 weeks as of the 31st of January 2022. 45%, 685,000 of those first had or suspected they first had COVID-19 at least one year previously. Yeah. I think of the wall across there at St Thomas's. I had some ladies, they're not my constituents, but they did a Zoom meeting there maybe about 2 or 3 months ago, and they were from Manchester, Liverpool and elsewhere, and they had reminded me of the wall because I was walking to the hotel one night and I passed it many months ago and realised what it was. And it's a wonderful memorial and memory to those who have passed on. And also, I think it was good to have that event on Tuesday past that the ladies and others organised to have that walk and give people perhaps an outlet, maybe, Madam Deputy Speaker, for their feelings. I think it was good to do that. We're 2 years past the first lockdown. The long-term effects of COVID are becoming very clear, and that we need to put protection in place for employees who have got this long-term illness that doctors cannot pinpoint, and yet they must struggle daily to live with it. No DDA form exists to give them any protection whatsoever. I absolutely agree that this government should urgently produce guidelines for employers in both private and public sectors on managing the impact of long COVID amongst their workforce. And further, we should launch a compensation scheme, which the Honourable Lady referred to. I think we have to do that to all frontline key workers currently living with long COVID. So I agree with the APPG when they say that the scheme should mirror the Armed Forces compensation scheme, which was discussed here on Monday night past here, recognising the relapsing nature of long COVID and go beyond the existing pay scheme. Long COVID is a debilitating illness. My constituent, I'm going to mention this gentleman. I've known him probably ever since he came to ours. He's a pastor of a church in my constituency. Almost lost his life in the battle against COVID. He's 6'4". He's a big strapping big man, and he was brought to his knees. He walked up the hill to Stormont as part of his duties as a member of the church, but also because he believes as a voice for the voiceless protest. And I thought he was going to have to lie down. Long COVID has hit him incredibly hard. He has headaches. He's 1 day of good, and then he's 3 days of bad. He has headaches. He has stomach upsets, and he's all those things. But he suffers from blood clots, reduced lung function, chronic fatigue. His church are happy to allow him to rest as he needs. And should he have worked in some other companies, not mention them, he would have no similar protection. This leads me to my next point, that we must improve current long COVID care pathways with a view to improve and to ensure the healthcare system is capable of meeting current and future demand. Can I, Madam Deputy Speaker, mention the Shadow Minister? I do it because there was a debate in Westminster Hall one time, and I mentioned about people, my constituents, and that man I talked about there had brain fog. The Shadow Minister has lived this all himself. I think it's important that we do say that. But here's one of our own friends and colleagues in this House who has lived with long COVID and has found it incredibly difficult, as others have, to deal with that. So you're not far from our thoughts, any of us in the House today, in relation to being... The right honourable gentleman. Sorry, I'm probably getting carried away on the emotional vacation. I apologise. Has the Minister's Department been able to collect the data in relation to those with long COVID? Flexibility for those who are in full-time employment, employment guidelines that the Honourable Lady for Putney referred to. That's what I want to see. I think that's what we all want to see in this House. And perhaps the Minister could confirm that the lessons that have been learned reference COVID-19, as the Honourable Lady for North East 5 said, that there will be other diseases that will come along, and we've got to be prepared. So what we learn from this one will make us all the smarter for the next one. And I put it on record because I think it's important when we're talking about these things, how well government reacted to the system. The compensation schemes they had for businesses, the COVID-19 vaccine, those are positives, and they give us heart whenever perhaps maybe at some stages we were down in the dumps. So I think we want to say that as well. Roughly 4% of UK's workforce, and I conclude with this, Madam Chair, roughly 4% of the UK's workforce has had long COVID, and I'm given to understand that 82 million work days were lost due to long COVID absence in NHS England between March 2020 and September 2021. The real figure may be higher, as long COVID was not classified as a reason for absence at the start of the pandemic. It is clear that the effect on business is real. And that's why this debate today. And there has to be structures in place to deal with this. Again, I thank the Honourable Lady. I thank everyone for their contributions. I look very, very much to the Shadow's contribution. But the Minister is a friend of us all. I look very much to what he will say. Thank you.
Yeah. Marion Fellows.
Thank you, Madam Deputy Speaker. And it's a pleasure to speak in this debate. And I'd like to thank the Honourable Member for Oxford, East and Abingdon. Sorry, I beg your pardon, West and Abingdon, and all the other folk who have spoken already in this debate. And can I mention the member for Oldham East and Saddleworth, who talked about staff being disciplined because they have long COVID. The Honourable Member for City of Chester, who gave a really personal testimony and really explained to me much more about how it affects families in its entirety. And to the Honourable Member for North East 5, who really, the application forms are the bane of all of our existence. And if you are not well, then it just becomes far more difficult. The Honourable Member for Putney, who especially raised the idea of employer guidelines, and the Honourable Member for Strangford, who of course gave his unique take on this, mentioning his wife and family, and really bringing a real personal touch to the debate. So I thank all of them. Madam Deputy Speaker, the scale of long COVID can't be underestimated, as we've heard, and has a significant impact on the UK workforce, especially affecting key workers. The ONS latest monthly estimates show that over the 4-week period ending 31st of January this year, an estimated 1.5 million people across the UK self-reported experiencing long COVID, 2.4% of the population, including 119,000 folk in Scotland. And this data shows that long COVID systems are persisting for longer than 4 weeks, appear to have a higher prevalence in working age adults between the ages of 35 and 49. And a survey last month, which has already been referred to by the Chartered Institute of Personnel and Development, the CIPD, found that a quarter of UK employers cited long COVID as one of the main causes of long-term sickness among staff. These are things that we're now having to deal with, and key workers themselves appear to be more at risk of long COVID, and that really has to be looked in. We're still learning the true impact of long COVID on an individual's physical and mental health, and we know what the most common symptoms are, but we still don't understand long-term issues. And the CIDP report points out that as a new condition, people sometimes don't know that's what they've got, and it takes quite a long time for a diagnosis to be given. And again, there's a double burden of uncertainty regarding how best these folk with long COVID can navigate their work, and that's really affects sickness absence and return to work. These are all. Will the Honourable Lady give me? On that point, yes.
Just very briefly on that, yes, that is one of the key issues for first waivers with long COVID, the fact that they didn't necessarily have a COVID test. And I do think that's something that Department for Work and Pensions, the government should look at in terms of when GPs are looking at a list of symptoms that can only be long COVID, there's an acceptance that that is what they're suffering from.
So, as we've already heard, and I thank the Honourable Lady for her intervention, and as we've already talked about, some members have already spoken about ME, and where it's very non-specific and can be different, it's quite difficult sometimes to diagnose, but people should be believed, and that, I think that's the main issue I would raise in regard to that. Support is already being delivered across Scotland for those suffering from long COVID, and the Scottish Government is indeed committed to do more. And they recognise and acknowledge the impact that long COVID can have on the health and well-being of those affected, and has encouraged all employers to apply fair work principles and a flexible approach to dealing with the impacts of COVID-19 in order to protect the health and well-being of the workforce. In the event NHS Scotland staff are absent due to COVID, current temporary measures ensure they are paid as if at work and are not subject to corresponding sickness absence triggers. And the Scottish Government continue to support NHS colleagues with the provision of these temporary sickness absence measures in the event they contract COVID-19. And again, the Scottish Government has a long COVID strategic network which actually helps to bring things, it brings together clinical experts, NHS boards and lived experience, because that's one always in any disease or any issue, lived experience really can give those who are trying to help a real experience of what is needed to be done. Following analysis and planning by the strategic network to identify where additional resources is needed, the first tranche of funding to NHS boards will be made early in the next financial year, which starts tomorrow. The fund will provide additional resource to support NHS boards to develop and deliver the best models of care appropriate for their populations. But, Madam Deputy Speaker, this is about the effect on the workforce, and it's really important that workforce know what's maybe wrong with them. It's really important that employers know what long COVID is about. So the Scottish Government carried out a marketing campaign in October and November last year to raise awareness of it and to signpost people to appropriate support. The campaign supported the production of posters for displaying community pharmacies, GP surgeries across Scotland in different languages, social media posts, and a campaign toolkit sent to 250 direct partner contacts, with the additional distribution of approximately 3,000 plus other places that it went. I want here to mention again the APPG and the good work that it has done. And it recommended that the UK Government commits £100 million per annum to funding research into diagnostic and treatment pathways for long COVID patients. And again, the Scottish Chief Scientific Officer's Office is funding patient-led, Scottish-led project with total commitment to funding. And again, the work there is being done and it's being disseminated widely. Madam Deputy Speaker, I think I cannot finish this without talking about statutory sick pay and the effect that that has on people with long COVID. It's having a disproportionate impact on groups already disadvantaged in terms of work and health. And to limit further health and inequality, the UK Government must ensure a livable sick pay for all. We're clear that in the SNP that we need to have a system fit for the 21st century, and we really need to look at those people who are earning the least, because you can't even get statutory sick pay if you're earning less than £120 a week, and that's the case for many. And the fact now that the government has moved away from statutory sick pay from the first day of sickness, this impacts hugely on people. And it's quite ironic, Madam Deputy Speaker, that the Prime Minister claimed we should be more like the Germans and not go to work when we're sick. Well, considering that Germany is one of the best sick pay systems in Europe, with laws requiring employers to pay staff 100% of wages for the first 6 weeks of sickness, and by contrast, the UK has one of the lowest. I remember in this chamber listening to a member in the benches opposite saying that £96.35 a day was quite a good statutory sick pay benefit, and when she was told that it was £96.35 a week, she was quite shocked. And I was quite shocked that she didn't know that. It's absolutely appalling. I mean, we are one of the richest countries in the world, and people can't afford to stay off sick I mean, it's just disgraceful. And the fact now that, you know, you have to qualify and wait, is it 2 weeks before you can even access it, is just absolutely ridiculous. This government didn't bring in an employment bill in the last Queen's speech. It should in the next. Flexible working would also help people with long COVID. It would help them in the days that they are better able to work and they would have to trail into work. Again, there was a B's consultation. Can we find out what's ended over 3 months ago? Can we find out what's happened? So, in conclusion, Madam Deputy Speaker, while employment law remains reserved to Westminster, the SNP Scottish Government are using the Fair Work policy to promote fairer working practices across the labour market in Scotland. And I really would urge the Minister to look at what's happening and to look at statutory sick pay, to look at helping people, not just with long COVID, but as this is the subject of this debate, really that would be a huge improvement in the lives of those unfortunate to have this terrible condition.
Minister Andrew Gwynne.
Thank you very much, Madam Deputy Speaker, and I would like to begin by sincerely thanking the Honourable lady, the member for Oxford West and Abingdon, for all the work she's done on this particular issue, but also for the way that she opened this debate today. I'd also like to thank the Backbench Business Committee for granting it. Thanks also to the members that have taken part in the debate, in particular my honourable friend, the member for Oldham East and Saddleworth, my honourable friend, the member for Chester, and I thank him sincerely for his kind words. It's nice to know that my experiences have helped somebody else with theirs, and I wish his family member well for the future. Also, the Honourable Lady, the member for North East Fife, my honourable friend, the member for Putney, and she's absolutely right to draw parallels with ME too, both in terms of some of the symptoms, but also how that particular community has been treated over a number of years. My honourable friend, because he is my friend, the member for Strangford, for his kind words too. Madam Deputy Speaker, as colleagues will know, not least because it's been mentioned in the course of this debate, long COVID is an issue that is very close to my heart. Back in March 2020, I first caught COVID. Madam Deputy Speaker, that was 107 weeks and 4 days ago, and I am still struggling with some of the symptoms of long COVID all these weeks and days later. Back then, I felt rough with COVID, but to my relief, avoided a lot of the more serious symptoms that we were seeing on the news and hearing from friends and colleagues at that time. It wasn't great, but I wasn't hospitalised, was the blessing that I had. However, when my self-isolation period ended, and in theory I should have been fine to return to work, I found that I couldn't. I found that I was perpetually exhausted. I couldn't catch my breath. I would be talking to my wife and suddenly words would vanish. I would try and pick them out, but I couldn't find the right ones. I would forget things, lose track of why I came into a room. I would sweat like I'd run the London Marathon just for doing routine day-to-day things, like making a cup of tea. I felt completely terrified. My symptoms weren't going anywhere. Instead, they were evolving into something different and seemingly something permanent. In May of 2020, Eliza Perego coined the term long COVID to describe these persistent and wide-ranging symptoms. I felt like a bright light had been shone on what I had been going through, and we now know that over 1.5 million people suffer with long COVID in the United Kingdom, and that the majority of these, 989,000, say it affects their daily activities. It certainly affected mine. I'm very fortunate to have a brilliant team across Westminster and in my constituency of Denton and Reddish, and they stepped up on my worst days, when getting out of bed literally felt like running a marathon, They made sure that my constituents were still well represented and that I was given sufficient time to rest when needed. And that was a hard lesson too, listening to your body. However, millions of people in this country are not as fortunate as I was. We have some of the worst sick pay provision in the OECD, and we are in an age of precarious work. And in this context, long COVID becomes an economic as well as a health emergency. The fact of the matter is, Madam Deputy Speaker, that there has been an acute failure on the part of government both to take long COVID as seriously as perhaps it should, because it isn't just a health issue, it is an employment and a DWP issue. And government could, and I believe should, be doing more to encourage workplaces to better support those suffering from long COVID and to allow employers to understand precisely what long COVID means for their workforce. From December 2021 to January 2022, the most recent time period we have access to, it's been shown, as I say, that of the 1.5 million people currently suffering from long COVID, only 2,869 had attempted to access the post-COVID assessment service. Of that tiny number, 34% had been waiting for longer than 15 weeks. Something is going very wrong. Almost 1 million people are reporting long COVID symptoms that are adversely affecting their day-to-day lives, yet just a fraction are attempting to access care, and only a fraction of those are actually getting it. Now, I would be grateful if, in his response, the Minister could set out what conversations he's had with colleagues in the Department for Health and Social Care about these figures, and what action the government will be taking to ensure that those who have long COVID can actually access the care that they desperately need. Because this is actually quite crucial, because for a proportion of those people, with the right rehabilitation package, work can become viable again. And I want to share with him some data that I've received from Nuffield Health. Now, they operated a free 12-week programme, and so far they've helped over 1,900 people from across the UK to recover from prolonged effects of COVID-19, including breathlessness, anxiety and fatigue. And I was one of the 1,900 that took part in this free programme. The results that they have today shows that 64% of them, it improved mental well-being. For 39% of them, it improved their functional capacity. For 39%, it improved their breathlessness. For 35%, they saw an improvement in fitness. And for 30%, not an insubstantial number, they were absent from work but felt that they could return. Now, it's not a silver bullet for all, because those are still minority figures, but for 30% to be able to return back to work with the right rehabilitation programme, I think that is something quite encouraging. Now, as has been pointed out on numerous occasions today, 4% of the UK workforce currently have long COVID. That is an extraordinarily high number and will no doubt be having an impact both on workplace productivity but also on wider employment outcomes. The Chartered Institute of Personnel and Development found that a quarter of UK employers cited long COVID as one of the main causes of long-term sickness among their staff. Yet those living with long COVID have had very little in the way of workforce protection. Now, in my capacity as Shadow Minister for Public Health, I have been inundated with stories of employees facing an uphill battle to have reasonable adjustments implemented in their workplace. I've heard from doctors unable to return to work, of NHS staff who have been sacked or had contracts terminated because of long COVID symptoms. These are people who carried us through the pandemic, people who we stood on our doorsteps and applauded. We can do much better than this. Now, Madam Deputy Speaker, I want to just talk about the help that I had in returning to work, and I want to pay tribute both to Mr. Speaker but also to the staff in the Speaker's office, because I am lucky to work in an environment where reasonable adjustments were made. When I first returned to the House in person after the summer recess, I found that I couldn't bob in the chamber without becoming incredibly fatigued, and then that would trigger my brain fog. And after almost collapsing during a ministerial statement on Afghanistan, where I'd been bobbing for almost an hour, I arranged it for a meeting with the Speaker on the basis that I can't do my job. And if I can't do a simple task like bobbing up and down, then I may as well pack up and leave. I can't do my job. And it was the Speaker and his brilliant staff who advised me that instead of rising on each occasion, I could simply just hold up my order paper. A simple solution that made a huge difference to my health and well-being, and I thank the Speaker sincerely, and indeed you, Madam Deputy Speaker, and the staff in the Speaker's office for being so understanding. But reasonable adjustments shouldn't just be made for members of Parliament. The government needs to be doing much more to empower employees to approach their bosses and have these kind of conversations. The problem is, with practically zero workplace protections for long COVID in place, these conversations become incredibly difficult to have. Now, we on this side of the House recognise the threat that long COVID poses both to the health of this nation but also to the British workforce. That's why we would end the postcode lottery of long COVID care provision, we would fix the shameful state of sick pay, and we would engage with employers to support those with long COVID. COVID has not gone anywhere, and it is profoundly irresponsible to just stick fingers in ears and pretend that there aren't 1.5 million people still struggling. Tomorrow, free lateral flow testing will end, and as a result, COVID cases will rise. This makes it much harder both to track the level of COVID in the UK and, by extension, the amount of people who will potentially then go on to develop and live with long COVID. So, I will give way.
I'm extremely grateful to him giving way, and I'm glad he's brought up this point, because he will have heard the difficulties that people have in accessing benefits, in proving that they have long COVID. You get long COVID by having had COVID, but if you can't get a test, then how do you know that you had COVID? And therefore it just makes it so much more difficult to prove down the line to access the benefits that they so deserved.
The Honourable Lady is absolutely right, and this is a real concern of mine, not least because I've experienced it. I was in the first wave of COVID. I literally caught COVID the weeks that the government said, if you develop symptoms, you no longer need to test, you just go into self-isolation. I knew I had COVID, and I know that COVID led to long COVID. I still to this day can't prove it because there was no routine testing available to be able to show it. So that is a real issue. And I am incredibly worried, Madam Deputy Speaker, that getting rid of free testing is a short-term decision which will have a major financial and public health implication for the foreseeable future. The government can't turn a blind eye to a problem that is having a devastating impact on the people of this country. One of the defining lessons of the pandemic is that we don't have the luxury of dithering and delay when it comes to public health. We urgently need a cross-departmental long COVID strategy, one that I would support, and I would gladly work and use some of my experience and advice with ministers to help develop. We need a long COVID strategy. We need proper sick pay. And we need the government to understand that it has an important role working with business and with industry to ensure that reasonable adjustments and support in the workplace can become a thing for all and not just for me.
Minister.
Thank you, Madam Deputy Speaker, and I'd like to congratulate the honourable members for Oxford West and Abingdon who opened this incredibly well, and Oldham East and Saddleworth, and indeed my honourable friend, the member for Central Suffolk and North Ipswich, who unfortunately couldn't be here, for securing today's important debate on the impact of long COVID in the workplace. And I'd like to thank the Backbench Business Committee and all of those who have taken part in the debate for their thoughtful and insightful comments. We've heard about the ONS estimate that over the 4-week period ending 31st of January 22, 1.5 million people in the UK reported experiencing ongoing symptoms following COVID. And out of those 1.5 million people, nearly 300,000 reported that their ability to undertake day-to-day activities had been significantly limited. And it's clear, therefore, that long COVID, as we've heard, presents a growing challenge for the workplace and more widely. Now, that emergence of a completely new condition, like long COVID, is a real rarity. Much like our experience of the COVID-19 pandemic itself, we must and are constantly developing our understanding. We put support in place for those suffering from the condition. NHS England has to date invested £224 million to provide care for people with long COVID. It's established 90 long COVID assessment services across England, and those services are assessing and diagnosing people experiencing long-term health effects as a result of COVID-19 infection, whether they've had a positive test or are likely to have long COVID based on those clinical symptoms, regardless of whether they were admitted to hospital during their COVID-19 illness. The services offer physical, cognitive and psychological assessment and, where appropriate, refer patients onto existing services for treatment and rehabilitation. I know that the Honourable Lady talked about the $1 billion in the States. I have to say that not all of that has been allocated yet, and the UK is already ploughing ahead, and it's quite far ahead compared to other countries, including the States, in their research in this area, but clearly there's more we can always do. Getting that right healthcare and treatment in place for individuals is clearly an essential step for them and for their employers and for the wider economy. But the theme of today's debate is the impact of long COVID in the workplace. Now, people can suffer from many long-term health and other conditions which may impact on their work. We've heard about ME, we could talk about fibromyalgia, we could talk about Guillain-Barré, Miller Fisher, all of those kind of things. And indeed, there's other areas that are not necessarily post-viral. Earlier this month, I gave evidence to the Women and Equalities Committee on the impact of the menopause in the workplace. And in February, I responded to the government at a Westminster Hall debate on supporting people with endometriosis in the workplace. Again, very different conditions, but nonetheless long-lasting, and areas that we need to make sure that we can keep people with the right treatment, the right reasonable, and indeed in the Honourable Gentleman's a simple adjustment, which actually was a natural thing to do, which made his working life so much easier. Again, with so many of these other conditions, there are small things that employers can do that can keep people in the workplace, and it does not have to be complicated. It certainly doesn't have to be expensive in so many different examples. So we believe that employers can and should play a significant role in supporting people with long-term health conditions to access and remain in work. It can certainly benefit individuals, but it can also bring real bottom-line benefits to employers, avoiding recruitment costs and not unnecessarily losing experienced and valued members of staff, for example. But it's not a sustainable approach for every single condition to get different or special treatment. For employers, that could lead to confusion and complexity, likewise for employees themselves. And that's why the government's starting position is that in terms of the workplace, specifically in terms of the workplace and overall framework for providing health support to employees, long COVID should be treated the same as any other long-term health condition. And let me set out that framework, and as you'd expect, it is a cross-departmental effort. The government's response to the Health is Everyone's Business consultation, led by the Department of Work and Pensions, was published in July 2021. It sets out some of the measures we'll take to protect and maintain progress that's made to reduce ill health-related job loss and see 1 million more disabled people in work from 2017 through to 2027. Health, yes, I'm happy to go.
To the Minister, and I'm listening keenly on what he's saying, but the issue is that this is an infectious disease that is contracted partly as a result of exposure, and there's clear evidence that exposure takes place in the workplace. So it's not different, it's not the same rather than existing progressive illnesses or fluctuating illnesses. It is very much an infectious disease contracted in the workplace, and that's the basis for our our recommendations.
No, I understand the point. What I'm trying to set out is the framework for managing long-term illness. But indeed, clearly, we still have support in the workplace for infectious diseases, which actually we know. I cited ME, fibromyalgia, Guillain-Barré, Miller-Fisher. They're all post-viral infections. They have an infection beforehand that typically leads on to those other long-lasting conditions, and so that's why I'm compartmentalising that framework. But nonetheless, I very much take her point about the infections in the first place. Now, health is everyone's business. Didn't consult on long COVID or any other specific health condition for that matter. It looked at those system-level measures to support employers and employees manage any health condition or disability in the workplace. And the measures, therefore, that we're taking forward include providing greater clarity around employer and employee rights and responsibilities by developing a national digital information and advice service, working with the Health and Safety Executive to develop a set of clear and simple principles that employers would be expected to apply to support disabled people and those with long-term health conditions in the work environment, and increasing access to occupational health services, particularly for SMEs, who we know are currently underserved. And as I've said, while these measures are not long COVID specific, they're key steps in our effort to change the workplace culture around health and sickness management. That will benefit those suffering from long COVID, the same as those suffering from those other longer-term health issues or disability. But we're also responsible, as the Honourable Lady, for the member for Motherwell and Wishaw said, about flexible working. And it's a particular policy that we know can be incredibly helpful to those suffering from many long-term health conditions, including long COVID, as they seek to manage the symptoms, some of which we've heard today, like extreme tiredness and insomnia, depression, anxiety. And whilst that doesn't provide the whole answer, flexible working can really be an important tool for both employers and employees as they take forward discussions about how to better balance the demands of work and life, in particular for those managing some long-term health conditions. And the consultation also introduced plans for a future call of evidence on the subject of ad hoc flexible working, where we want to explore how non-contractual flexibility works in practice. And I discussed this with the Flexible Working Task Force in February, and we're going to ensure that the role of ad hoc flexible working in supporting those with long COVID and other health conditions, like the menopause and endometriosis that I've cited, is part of its considerations. Yes, I'll give way.
Can the ministers advise me if they're looking at cutting the time in which someone can actually apply for flexible working? Because at the moment, you have to be in work for quite a long while before you can do so.
And our manifesto commitment was to consult on this, and what we're clearly looking at within that consultation was a day one right to request flexible working. I think that's the key thing, because that's what will attract people to a good workplace, or will keep them in a good workplace, and you might as well start as you set to carry on, frankly. But another significant part of the cross-departmental framework is the Government Equalities Office, responsible for the Equality Act. It's an important part of the matrix because it may protect those who have long-term health conditions from discrimination. It's those people that the Act ensures that any person with a condition that meets the definition of a disability is protected. Now, the legislation describes disability, so it shouldn't be stigmatised. It describes disability as a physical or mental impairment which has a substantial and long-term adverse effect on a person's ability to carry out normal day-to-day activities. And as we've heard, not least from the Honourable Member for Denton and Reddish, but by the incredibly passionate speech, the member for City of Chester citing his family member. And by the way, I know the difficulty when someone is describing a family member that is suffering from something that we're debating, and I thank him for his personalised experience there, which has really informed this House and contributed so much positively to this debate. But that disability, as I say, shouldn't be stigmatised as some may have it. It is just simply talking about that impairment, which we've heard loud and clear today. Long term is defined as having lasted or being likely to last for at least 12 months, and substantial is defined as more than minor or trivial, again, as we've heard by some very strong examples today. But the Act makes clear that it's not necessary for the cause of the impairment to be established, nor does the impairment have to be the result of an illness. A disability can therefore arise from a wide range of impairments. So that means that any person falling within that definition would already be protected as having a disability. And it can therefore encompass some of the emerging effects of long COVID, but every case will be different and should be considered on its merits. Now, I want to, again, as I pay tribute to the Honourable Member for the City of Chester, I wanted to thank the Honourable Lady, Member for Oxford Western Abingdon, and please pass on our regards to Andrew, Nell and Rebecca. And we also heard about Julia Wells and her daughter earlier on as well, and the caring responsibilities that have. And these examples that we've had do really add colour and inform this debate. The Honourable Member for Motherwell and Wishaw talked about statutory sick pay. And, yes, we've talked about the fact that we do need to look at statutory sick pay. This is not the time to do it, particularly whilst we're in the middle of the pandemic. But we also need to look at statutory sick pay in the round. She cited people earning under £120 a week, but many under £120 a week are already in receipt of other benefits. And so that's what I mean about not just picking one sole issue and concentrating on that. It's the whole person, the whole personal finance that we need to look at. But to summarise, we're supporting people with long-term health conditions, including long COVID, by working hard on the general approach to work and health through the response to the Health is Everyone's Business consultation, taking steps to make some of our employment rights work a little harder to support those balancing work with other issues and challenges, and all of that is underpinned by the protections against discrimination provided by the Equality Act. We must also showcase the good employers, as again was cited by the Honourable Member for the City of Chester. So, one final time, and then I'll conclude.
So I might understand the consultation is happening. Guidance will be provided more comprehensively for all longer-term illnesses. I suppose the issue that we have, particularly with long COVID, is that it's so new that many employers haven't got a clue what it is. Would he consider perhaps suggesting a public health information campaign, particularly targeted at businesses, so that they know that it exists and where they can go for such guidance?
I often talk about ACAS guidance, and obviously ACAS have provided guidance in this area. I know the Honourable Lady cited what she saw as shortfalls within that guidance, and that's something we'll always look at to make sure that guidance is up to date, especially with an evolving condition like long COVID, because I keep citing ME. ME was one of those diseases, as is fibromyalgia, which is very poorly understood by so many people in the workplace, even by health professionals, frankly. So it will evolve, and I'm sure we will be able to push that information out to employers. But I hope you all agree that so far it's a wide range set of action to address those long-term health issues in the workplace, whatever those health conditions are, because we want to encourage a better culture around work and health, including those suffering from long COVID. Madam Deputy Speaker, I firmly believe that it's an important principle to have a single, consistent and clear approach to managing health in the workplace. It's unsustainable to have a number of different approaches for different conditions. But again, I'd just like to close by thanking everyone once again for this helpful and informative debate.